Hey everybody, thank you so much for joining us today. We have a very special guest, Dr. Cole Weedle here from Heart of the Rockies Regional Medical Center Urology Department. And I'm going to go ahead and just preemptively just remind everybody that I'm going to have you on mute. We are going to record this today, so all of our participants who are unable to join us in person are going to have access to this, and we'll share how you'll have access to that at a later date. But we're going to go ahead and save all of our questions until we have the presentation from Dr. Weedle, and so write down any questions that you have, and I will go ahead and turn it over to Dr. Weedle here, and you're going to see a screen share of his presentation. Awesome, and then let me get you set up with presentation mode. Alrighty, I think we're good to roll. Awesome, cool.
Did you hit the record button?
They're asking if you hit the record button.
Yes, I did.
Yes. Can everybody hear me?
Yeah, but I think you need to enlarge your screen. We're still seeing all the external parts there. You didn't. I think you got to click on one more click there. Because we're seeing all the slides that are coming up next.
Is that
There we
better?
go. Perfect. Thank you.
Awesome, great.
Can you do me a huge favor?
Of course.
This is my nurse. Can you just see if it's an emergency?
You got it.
Thank you.
Dr. Weedle's web is that-
Hi, everybody. Okay, so can everybody hear me? I'm going to take that as a yes.
Yes.
Okay. I'm Cole Weedle. I'm the urologist here at Heart of the Rockies.
Yeah, sounds good.
I was asked to talk to you guys for a little bit. I wanted to, obviously men's pelvic health is a large part of what I do. I was just going to talk.
It's kind of an urgent thing, if possible.
Okay, just 1 second, sorry. Hey. Yeah. Can you call 2450 and just see, like, he's still in a swing bed, so we need to read the scan, and he needs to just go back up to his room for now. Oh, okay. Well, tell him I'll be there in a sec then. But we're going to have to take a look at the CT scan and all that. So maybe just tell him to come back. Maybe just tell him to come back in an hour or so. Yeah, that's fine. Yeah. Thanks, Faye. Sorry about that. Duty calls. So I was going to talk a little bit about BPH and then focus on some of the minimally invasive options and make it pretty quick. And then if you guys have any questions, obviously I'm here to answer them to the best of my ability. So I'll talk about the anatomy of the prostate and some of the physiology of BPH, briefly touch on some history, and talk about what we do to evaluate and treat BPH. And then I'll talk about some of the newer minimally invasive options, and then I'll leave some time for questions and answer some questions that came up previously. So BPH is basically just stands for benign prostatic hyperplasia. It just means that it's non-cancerous growth of the prostate. Unfortunately, the part of the prostate that tends to grow with age is the part that surrounds the urethra, which is which is the fancy word for the P channel, and basically that's the part that grows most significantly as you age. And this is just a schematic there on the left. You can see the normal open prostate there when you're 20s, 30s, 40s. Then over time, due to a lot of factors, mostly bad luck and genetics, the prostate can grow and block up the bladder outlet as seen there. Briefly, some of the pathophysiology of BPH. I don't want to get too far into the weeds here, but I think it's important that you guys do understand this, and I will spend some time here because, one is pointing to the bladder outlet, and as the prostate grows, basically the signals become abnormal and it squeezes when it shouldn't. It's basically increased sympathetic tone, and so you're squeezing the smooth muscles of the prostate. It's not just physical blockage. And so that's how guys have weak flow, feeling like they don't empty their bladder, using, their abdominal muscles sometimes to push out some urine. And then 2 is a really important, what's labeled there as 2, is a really important feature of BPH. Basically, when that outlet is blocked, the bladder reacts, and you don't know this because the bladder's muscle is not under conscious control. The bladder muscle has to squeeze harder, and so your body actually puts more of these receptors on the bladder, and that is the urgency, frequency, getting up at night, man, I'm fine, and then I stand up and I gotta pee and look for the next bathroom everywhere between here and BV, or your favorite pull-off or whatever, and that's that's the other side of it, and it's sometimes hard to wrap your head around that. Sometimes if you leave the outlet obstructed for a very long time, that urgency stays with the man, and the bladder becomes essentially defunctionalized because those receptors are on the bladder and they don't go down even if you do open the outlet up. So this is kind of why you experience these symptoms here. There's the frequent urination, sudden urge, burning, a weak flow, hard to start and stop. And of course, down there in the bottom right corner is, when I see, a few guys every week really who end up in the ER because they can't urinate at all. So this is the most common prostate problem for men above the age of 50. I tell guys that if they put a % behind their age, that's how many men suffer from this in their age group. There are some things that increase the risk of BPH, or at least symptomatic BPH. Obesity is a big one. I would say diabetes is a huge thing. If you're diabetic and you have poor glucose control, you definitely will notice a worsening of your symptoms. A few myths about BPH. The growth of the prostate causing blockage is not prostate cancer. Prostate cancer is a different topic entirely. So most guys say, well, I have a high PSA, or I was diagnosed with prostate cancer, but I don't feel anything, or I'm asymptomatic. And that's because the area of the prostate that gets cancer is typically the outside of the prostate. So by the time you have voiding issues from prostate cancer, it's usually that prostate cancer is quite advanced. So BPH is not prostate cancer. It does not cause prostate cancer. The paradigm shift of prostate cancer in the last 20 years is that we don't treat nearly as much prostate cancers as we used to. Whoa. And so we do treat people with prostate cancer that are low risk that we are putting on an active surveillance regimen, meaning they have low risk prostate cancer, and we will do procedures and treat patients with medications because you can have both problems at once. This is also important. Prostate size does not correlate with severity of symptoms. I have some guys with let's put this in perspective. When you were 20, your prostate gland was probably 15 or 20 grams. I have some guys with a 300-gram gland that we aren't treating because they do fine. And I have some guys with a 20-gram gland that can't urinate at all. So it all depends on how the prostate tissue grows into the urethra. I have a lot of guys on prostate supplements or herbal remedies. Nothing has been proven in the medical literature. That doesn't mean they're not harmful. They're mostly going to harm you in the pocketbook, but I don't necessarily discourage it. I just kind of say, if it helps you, it helps you. But just know that nothing's been proven. And newer is not always better. The cynic in me comes out sometimes when I talk to these guys and they, have seen the latest late night commercial But just understand that, you guys are a big target. There's a giant number of men in your shoes who have urinary issues, and there's a lot of people trying to make money on a very large demographic. The basic evaluation that I generally do is a prostate exam. I'll do some uroflow testing where the man will urinate into a special urinal in my clinic, and I'll get a measurement of how fast their flow rate is. And then I check a lot of post-void residuals just to see how well the man's emptying their bladder. The AUA symptom score, the American Urologic Association symptom score, basically is how we monitor the guy over time. And it basically gives me an idea of how bothered the patient is by these symptoms. And then I'll just usually check to make sure that they have an updated PSA. For the guys who medications aren't cutting it or don't want to take medications or they're in urinary retention, there's all kinds of reasons to do an advanced evaluation. And basically, the first thing I'll do is a cystoscopy, and sometimes I'll do a prostate ultrasound at the same time. And that's done in clinic. If I'll need to do pressure flow studies, I will do a test called urodynamics, and that's also done in the clinic. That's a little bit beyond the scope of this talk, but sometimes I need to do that last study if things aren't as clear. Just be lucky, or just feel lucky that you live in the 21st century. This is something that's been going on for a really long time. Now men are living longer, but men still lived to the age of getting bad BPH symptoms in ancient history, and there's records of papyrus leaves being rolled up and used as catheters in Egyptian times. And then you can kind of see the progression of things. But basically the only thing you had before was catheters to manage these problems. There's been a lot of different therapies as medical science advanced in the 19th and 20th centuries. They used to just repeat x-rays and shoot them at the prostate. We've tried stents. And again, be careful what you Google. There's a lot of people who will take your money and do things that sound kind of sexy, but they're not proven yet. So this is kind of the treatment algorithm. We start with fluid and diet changes, watchful waiting, meaning basically doing nothing. Pelvic floor physical therapy is also, comes into this behavioral modification when I talk to patients, and that's Kegel exercises, bladder retraining, and then first line therapies, medications, and then there are these new clinic procedures that I'll talk about briefly, and then there are surgical procedures. So the medications, there are 3 FDA approved medications for the treatment of lower urinary tract symptoms due to BPH. The first is alpha blockers. This is kind of the mainstay. Anything that ends in osin basically is, when I showed you that diagram of increased smooth muscle tone of the bladder, of the prostate, that's what this is relaxing. The side effects, drop in blood pressure, dizziness, ejaculatory problems, fatigue. A lot of my really active guys don't like being on this medication because they feel like tired. They feel like they can't be as aggressive in their outside pursuits sometimes. 5-alpha reductase inhibitors, so you'll see this under the generic of finasteride or dutasteride or Proscar or Avodart. This shrinks the prostate down. Unfortunately, about 8 to 10% of guys will get erectile dysfunction, low libido, and then a smaller subset of those guys can get male breast growth called gynecomastia. And then there's evidence that sometimes if you take this drug away, those sexual side effects actually don't return, or those sexual functions don't return. Now that's a small percentage, but I do have to warn guys that I say, look, if sexual function is important to you, this might not be a great drug. In addition, it takes 3 to 6 months to work. The most recent drug is Cialis or tadalafil. We don't really know how it works, to be honest with you, but it probably relaxes the prostate in the same way it relaxes the blood vessels and gives you a better erection. The side effects are actually good, better erections. You can have some muscle aches and then some nasal congestion and headaches. The big thing here is that I tell guys there's no actual objective improvement in flow. It basically, that improves the guy's symptom scores, which is still important. It's, the guys feel like they're peeing better, but for the guys who have a really high urinary residual, aren't voiding very well, it's sometimes not the best medication. But for guys who have mild symptoms and also have some erectile dysfunction, it's a great medication. Insurance sometimes gives you trouble. However, it's become generic in the last few years, and it's pretty cheap in general if you go to the right place. So medication problems, just briefly, there's the side effects. That's the biggest thing. There's the expense. Most of these drugs are fairly cheap now. You're putting a Band-Aid on the problem. You're not truly fixing it. You're not remodeling anything. You're basically just putting a Band-Aid on it. There's data to suggest that a large percentage of patients stop taking their medications within a year. So the first, and then, modern techniques have allowed for clinic-based, minimally invasive techniques without a surgery. And so this has been kind of nice in the last 5 years to say to guys, look, if you're bothered by your symptoms but you don't want to take a medication, or if your medications aren't working but you don't want to do a surgery, sometimes these minimally invasive techniques are a good option. The first that I'll talk about is the UroLift. Basically, you're putting permanent implants inside the prostate to pull it apart and to open up that prostatic urethra. I did a lot of these in Denver. I don't do them anymore, and so I don't offer that here. If a guy really wants this done, I'll send him somewhere to get it done. But there's a few reasons I don't like this. I don't think it works as well. I just saw a lot of failures, and I think that I don't like putting anything permanent inside the prostate. It seemed to cause more bother over time, and I've had to take some of these implants out that other people have put in for calcifications on those little clips that you see there for various reasons. I do offer the Resume or the water vapor therapy. I do think this works fairly well for the right patient, and I think that's key. I'll talk a little bit about that here in a bit. But basically, you're using thermal energy and water vapor to kill prostate tissue. This is done with a cystoscopy or a lighted camera in the bladder, and I do it in the office. You can treat a lobe that goes into the bladder as long as it's a small one. So for guys who have big lobes that grow into the bladder, I don't recommend this procedure. The nice thing about it is it does preserve sexual function, and mainly in ejaculation. So guys don't have retrograde ejaculation with this procedure. And there's no permanent implant, which I like. And then we brought this to Salida a couple years ago. But basically, you can see a schematic here. There's a small needle that gets deployed into the prostate tissue, and then it shoots steam. And then I'll see if I can play this video. So basically, I fill the bladder with a bunch of lidocaine. My nurse does. I give you a Valium and a Percocet so you can kind of forget about what we're doing. And then I go inside. This is the urethra. And then he's going to enter the prostatic urethra here in a bit. So that's where the ejaculatory ducts come in. And now he's coming into the bladder here. And we measure how many treatments we're going to have to do. And that's what he's doing now. You can see he's going to pull back from the bladder because you don't want to get too close to the bladder. And then he'll inject the needle. And then 9 seconds of steam in each treatment. That's a little uncomfortable, depending on how well those medications set in and how well that lidocaine gets absorbed. And that's it on one. And then, I'll do anywhere between the lowest I'll do is 2, and the highest I've done is probably 10 of these treatments. Most guys are somewhere between, I would say average is probably 4. You're in the clinic for about an hour, but the procedure itself takes about 2 minutes. And then you'll go on the side here and do the same thing. in order to be a candidate for this procedure, you have to have a prostate that meets certain size parameters or insurance won't cover it. In addition, some guys just don't have the right anatomy. If the prostate is growing into the bladder significantly, this procedure just does not work as well. I think you guys get the point. Kind of boring there. After this is done, I leave a catheter for 3 days, and then the catheter comes out. For guys who have a lot of urgency symptoms, I find that this procedure does not work as well either. So if your prostate has the wrong size, the wrong shape, or you have a ton of urinary urgency, sometimes the urgency gets worse before it gets better. And I tell people for about 2 weeks, regardless, even if you didn't have a lot of urinary urgency, you will have some of that for 2 weeks afterwards. I would say most guys, if they can, prefer a shorter procedure to surgery, although I do think that this is probably less durable than the surgery. It works well for the right patient, and the retreatment rate is better than the UroLift. That's why I use this, or one of the other reasons I use it. And then like any procedure, it gets worse before it gets better. I think, the thing is to be careful. These companies make a lot of money off of urologists using their products and guys picking their products, basically. So just be careful. I think that's the biggest word of warning there, And then, prostate artery embolization is a good example of this. Basically, a radiologist goes in and injects the prostatic artery with some things that cut off the blood supply to the prostate. It's not recommended by the American Urologic Association outside of a clinical trial, and so these people will market this to you. So just be careful. It's not FDA approved, but there's no shortage of people willing to take your money. I tell people there's nothing wrong with the TURP. The TURP or the green light or the button TURP, which is what I do. There's a lot of different ways, but essentially it's going in, and instead of injecting that steam in there, it's a surgical procedure where you go in there and you remove the tissue or vaporize the tissue. It's still the gold standard for procedural management of BPH. There's nothing wrong with doing the TURP, and a lot of these companies will make money off of marketing their technologies instead of the TURP, so they'll kind of paint the TURP in a bad light. Newer technology has made it safer and much more effective. So final thoughts, I tell patients that treatments are usually a quality of life choice. Your degree of bother is my most important reason to do something. There are exceptions. If you start not draining your bladder and that causes kidney problems, if you can't get a catheter out of the bladder and you end up in the ER, if you get several urinary tract infections, if you have bladder stones, and then impending bladder damage, if I look in the bladder and it looks like at some point your bladder will fail or is starting to fail, that's another reason to do something. So, but that's, probably 10 to 15% of guys. For most guys, I say, look, I can make a sad person happier, but I can't make a happy person happier. And I think that's important to remember. Final thoughts, I love what I do, and I love working in a small town. I see patients from here, I go to Gunnison, I like seeing patients from the Valley, and my goal has always been to bring big city medicine to rural Colorado. Just a little plug for urologists. I joke that my mom still doesn't know what I do. She thinks I'm just a penis doctor. But we do a lot of things, erectile dysfunction, low T, prostate cancer, scrotal and testicular problems in men, and then we treat a fair amount of women. I'd probably say women are probably 30 to 40% of my practice. So we're not just male doctors. We do kidney stone treatments and prevention, overactive bladder treatments, kidney cancer, bladder cancer, and then urinary incontinence in men and women. How am I on time, Allie?
You're doing great.
Okay. There were a few questions that came up, and I'll address these real quick. Dietary recommendations. Well, you guys are going to get a talk on that, but I do say, when I showed you that treatment algorithm to begin with, behavioral modifications, pelvic floor physical therapy, fluid restriction at night, and then dietary recommendations are big too. And I usually give guys a handout explaining some things that'll make the irritation of the prostate and the bladder worse. If I had to list the 5 worst ones, it's carbonated beverages of any kind, seltzers, sodas, beers, alcohol of any kind, spicy foods, caffeine, coffee, tea, anything with vinegar or tomatoes in it. Basically everything that makes life worth living is going to make those things worse. But, I tell guys, and I use a personal thing, like those seltzers make my bladder go crazy, but I like them and I do it, but I just know I'm going to pee a lot for the next 2 hours. This was another question. It seems that alpha blockers are frequently prescribed for BPH. Some people are having sexual side effects, reduced ejaculate volume. Yep, definitely. Sometimes hard to orgasm and ejaculate. Yep. This is fairly common. I'd say it's about 5%. There are some alternatives. There are 3 main alpha blockers that I use, drugs in this class. I'd say that if a guy's having significant side effects from one alpha blocker, sexual side effects, sometimes I'll switch to a different medication called alfluzicin, and it might have a little less sexual side effects, but to be honest, if you're having bad sexual side effects from alpha blockers, switching to another one sometimes helps, but rarely significantly. If it bothers you enough, I would recommend looking into something else. Low doses of Cialis will reduce the symptoms of BPH and also help with erectile dysfunction. It is a win-win. Are there downsides compared to other alternatives? Well, yes and no. Like I said before, there's no objective improvement in your ability to empty your bladder or to, increase your flow rate. And so if people are having problems with that, then generally speaking, it's not a great drug. If people have mild symptoms but they're emptying their bladder well, then I'll say, yeah, it's fine to take. The data suggest that adding Cialis to tamsulosin has no effect, but I do anecdotally have guys that are on tamsulosin and Cialis, which, again, just because it doesn't work well for most guys, it does work well for some guys. The big thing is if you're on Cialis and tamsulosin, you have to make sure to take those medications at least 4 hours apart. Otherwise, it can lower your blood pressure. See an ad for Resume. I think I touched on some of the pros and cons of that treatment. Again, it works well for some guys. I think the terp is more durable. I think that there are some guys that aren't a candidate for the Resume, and there are some guys that would rather be asleep while I do something, to be frank. Digital rectal exams have fallen out of favor and have not been part of my annual wellness visits for the last several years. I have an annual PSA test. Should I also ask to have a DRE or digital rectal exam? I don't know if my prostate's enlarged. Will the doctor be able to give me some indication? We are very fortunate here to have very good PCPs, in my opinion, primary care providers. I tell people, I get this question a lot. I think if your PSA is normal, a DRE is not that helpful. There's a lot of data coming out that we're not very good at detecting prostate cancer with DREs. Now, I feel like since I'm a urologist, I do a lot, and so I'll do them. I'm trying to screen for prostate cancer. I have found prostate cancers in the past with normal PSAs and an abnormal prostate exam. Now, whether those are significant, would they have been clinically significant, and would the PSA have been elevated at some point enough for me to do a biopsy? Probably. So did it actually help the guy? I'm not sure. One of the reasons I do prostate exams is to get an overall size of the prostate. I mentioned finasteride before. I do not prescribe that medication to guys with small prostates because the data doesn't bear out that it works for guys with small prostates. So if I do a DRE and I estimate the guy's gland to be 30 to 40 grams or above, then it makes sense. But for the guys with smaller prostates, it doesn't make sense. So I'll do it in a large part to screen for prostate cancer, yes, but also to get a size of the prostate. If you're a regular doctor, I love all of our regular doctors, but you probably don't do enough to get an estimated prostate size, with a DRE. So it's okay if they don't do them, especially if they're doing the annual PSA test. The colonoscopy, I get this question a lot too. It starts with the DRE. They didn't talk about any prostate issues when you had your colonoscopy. You're right. There probably is an opportunity to talk to the guy about prostate health at that time. But there's also a lot of other reasons to do a digital rectal exam, and that's why they're doing it. They're doing it to see if they see blood, they're doing it to see if they see hemorrhoids, and they're doing it to see if you've got good rectal tone. They're not really feeling the prostate, and to be quite frank, I don't think, and again, I love our general surgeons and our GI docs, but I wouldn't really trust their exam anyway. So, they're not really looking at your prostate. Seen a lot of ads on TV for shockwave therapy for ED. How does it work? Who's a good candidate for it? And are there any side effects? Great question. Shockwave therapy has been a mainstay of urology for a long time. We use it to break up kidney stones. It is not FDA approved for erectile dysfunction, but there is some evidence to say that it might work. And basically what you're doing is breaking apart blood vessels and having them remodel, or maybe breaking apart the calcifications that's kind of preventing blood flow to the penis, and having the penis, remodel its vasculature. Does it work? I don't know, really. The data's not there yet. The people offering it, it's a cash pay thing. So of course they're going to tell you it works. Because insurance doesn't cover it, because it's not been proven. You got to be a little careful with that, because these low-dose shockwave therapies for erectile dysfunction, there are urology practices that do it. It's cash only. There are some references, and that's it. Yeah, of course.
Let me just pause our recording. All right. That's good. Hey guys, thanks so much. We're gonna stop our screen share for just a moment, and I'm gonna go ahead and pause our recording, and then we will open it up to questions. And okay, so we're gonna start. Let's see here. Start streaming. Nope. Recording. Oh yeah. Started it again. Okay, yeah, we're good. All right, Sally, let me get you set up here. Thank you. So glad to have you. This is awesome. All right. So we're going to go ahead and screen share here. Oh, there we go. Bring that back up. Screen share. And I've got your presentation right here. And we got our slideshow. And we are going to head to week number 5. All right, everybody, here is Sally, and again, we're going to kind of do the same format as Dr. Weedle, where if you can hold your questions to the end, just since we are currently recording, that'll be great. Then we'll stop the recording, and then we'll open it up to questions, and you can ask anything in particular, anything personally that you want to find out about. So thanks so much, and here's Sally. Do you want to stand or sit? What's better for you?
I'll sit, and we'll see how this goes.
Yeah.
So is the video on? Can they see me?
They can see you.
Okay, good.
Yep.
Okay, good. And so I'm going to ditch those. And I'm just going to make sure we get to the right. There we go. Great. Hi, everybody. So I could see a few faces and etc. while I was in the audience, but now, of course, I can't. So welcome. And my name's Sally. I'm the dietitian here at Heart of the Rockies. And yeah, a little about my background. Allison, thanks for the prompt on that. So I've been a dietitian for 35-ish years, and I'm also a chef, and because I love food and I love to eat. And I love to teach people about healthy eating and how they can enjoy food and stay healthy, right? Because that's the name of the game, is we want quality of life. And so today I'm actually going to step back a little bit and talk about big picture healthy eating for quality of life, and I love that I quickly wrote down the things that Dr. Weedle mentioned about that can worsen bladder health. And but yeah, I'm going to look at big picture, and I'm going to refer to my notes a little bit too. And but yeah, healthy eating the colors of the rainbow. I'm going to talk about that a fair amount today. I'll keep coming back to it because eating a big variety of foods ensures that you get all the vitamins, minerals, nutrients that you need. Especially when you eat the colors of the rainbow, you get different phytochemicals, so small chemicals that are in food that may help prevent or fight cancer. And I'm going to say may and might a lot. There's lots of research out there. Some of it says yay, some of it says nay. I would always recommend that if you come across some new different thing, check to see what is the research behind that recommendation. If you hear something, ask. Do your homework, right? Because there are lots of fads out there. And, like Dr. Weedle mentioned as well, sometimes people are out to simply make money and not necessarily provide you with good, solid, evidence-based information. And so, have you heard about food as medicine? All right, I have. And because it should be medicine, right? Wouldn't you rather eat a peach or a plum instead of take a pill? Yes, right? And so, for example, some things that that maybe you've heard about, or maybe they're evidence-based bits of information. Oh, vitamin B3, right? Niacin, that can help lower our LDLs, which lowers the risk of stroke and heart disease. Vitamin D, right? Good for bone health. We all know that. Also good for immune health, right? Also helps to strengthen muscles, including your pelvic floor muscles. So making sure that you get adequate levels of vitamin D also helps to decrease the likelihood of incontinence. Antioxidants and phytoestrogens. Again, those are small compounds in food that are believed to help either reduce the risk of some cancers or suppress tumor growth, things like that. So you'll hear me mention those a few times. But yeah, food is medicine, and it tastes better than pills. So today we're going to look, again, big picture, right? We're going to aim for healthy eating. And this is good for all of us, male, female. We'll talk about maybe some differences specifically for men to make sure you get enough calories, things like that. And then we're going to break these down, these 9 points, and go through them a little bit more in detail. So please aim for a minimum of 5 servings of fruits and vegetables per day, and eat all different colors. When you're choosing your whole grains, or when you're choosing bread, pasta, cereal, tortillas, select whole grains. More fish up, red meat down, right? It doesn't mean you have to cut out the red meat, doesn't mean you have to eat fish every day, but more fish, lean poultry, take off the skin before you eat it, increase your intake of beans and legumes, we'll talk about that a little bit more, and eggs. Eggs are healthy. Eggs sometimes get a bad rap, but they're healthy. Limit red meat, processed meat, things like hot dogs, bologna, beef jerky, Slim Jims, stuff like that. Right? We'll talk about why. When you're choosing your fats, be choosy, right? Pick the healthy ones, so olive oil, nuts, butters, nut butters. Avoid the trans fats, and again, those things are found in the processed meats and in fast foods. Avoid sugar-sweetened beverages like soda and juice, actually. Believe it or not, juice is not my favorite. And limit your sweets. When you're looking at salt, sodium, 300 milligrams per serving, or try to keep it around 2,000 milligrams per day. In general, check your portion size, right? We'll talk about that a little bit more as well. But eat slowly. Stop when you're full. Some folks say stop when you're 80% full, because it takes a few minutes for this to tell this that, okay, done, right? I'm done, I'm full. And lastly, maintain a healthy weight for your height. So that's information that's easily found on the internet, and but it's a great goal. And sometimes even a weight loss of 10% can help reduce the risk of diabetes, heart disease, and stroke. And I will tell you that when I look at people, I sort of take a look and I'm like, oh, diabetes, heart disease, stroke. 1, 2, 3, do you have all of those? If you have one, you're more at risk for the others. So keeping it healthy is important for your overall health. And I love this, the chart that I found from the Prostate Cancer Foundation, right? The periodic table of fruits and vegetables. And it does have all of the colors of the rainbow represented. And plant foods, they don't have saturated fats, right? They're typically low in fat. They're high in fiber. They have all those phytochemicals. They're great options. So as many fruits and vegetables as you can get per day. I think I mentioned 5, right? I'm going to give you more information about that as we go along. But yeah, I just thought that was a great demonstration of all the types of fruits and vegetables out there and how can you fit them into your day. So we'll start with that first recommendation. 5 servings of fruits and vegetables per day, that's a minimum. You know, the American Heart Association these days is saying 8 servings of fruits and vegetables per day, right? So, you know, it's a minimum of 2 cups of fruit and 2.5 cups of veg. And if you can, 4 servings of each is ideal. Especially, you know, the big picture of the broccoli on the slide before, the cruciferous vegetables, so broccoli, cauliflower, cabbage, Brussels sprouts, all those, they have lots of antioxidants and lots of anti-inflammatory properties. So they should be included every day or as many days as possible. And why do we love fruits and vegetables? Number one, okay, they taste great, right? Nature's candy. Oh, right, and they provide vitamins, minerals, fiber, the phytochemicals, and they provide water. And that's one benefit of eating fruits and vegetables is you get some water along the way. Better than just a vitamin pill. Oh, can I just take a multivitamin and have it all covered? I'm going to get to multivitamins later. Okay. So phytochemicals, again, they help protect against DNA damage. They may reduce the risk of prostate cancer. They can help eliminate free radicals to keep cells safe. And you know, one of the best things about fruits and vegetables, they make you feel full. There's a lot of fiber. Some recommendations say eat the fruits and veggies first. Fill your tummy. And then there's less space for the other things that are more calorie dense that might be included in your meal. When selecting whole grains, at least half of your grains should be whole grains. Again, it's things like your bread, your tortilla, crackers, cereal, any of your grains. Oh my gosh, right? They provide all of the fiber that comes, or not all, but most of the fiber in your daily intake. What does fiber do? Keeps us regular, right? First and foremost. It also, and in that regularity, helps to maintain your pelvic floor muscles. That's the insoluble fiber. That's the stuff that provides the bulk. That's the cauliflower, it's the broccoli, it's the apples, it's the bananas. It provides the bulk, right? That keeps us regular. Insoluble fiber feeds that microbiome in our gut. That weighs about 8 pounds. So you have 8 pounds of healthy bacteria in your gut that can affect your health from your toes all the way to your brain. So we want soluble fiber and insoluble fiber. Soluble fibers also, so soluble fiber, great sources of soluble fiber, oats, apples, those are some of the things that give us soluble fiber. That's what helps to regulate blood sugar. So if you're diabetic, it can help to keep your blood sugar more stable. Also reduces the formation of plaque in our arteries and our veins. And also, fiber makes us feel full. So here's one of the things too that I, because everybody says, oh, all right, 30 to 38 grams of fiber, that's for the average male. The average female needs about 25 or so grams of fiber per day. What does that look like? How on earth do I figure that out? Well, of course, there's reading the labels, right? That's one of the things. Read your nutrition facts label. Fiber is always included right underneath the carbohydrate amount on the label. But I just put together a day that has an approximate amount of fiber for the average man. Breakfast would look like a cup of oatmeal that has about a tablespoon of pumpkin seeds and a couple tablespoons of walnuts and a fresh apple cut up and mixed in. Lunch would look like 2 slices of whole grain bread with whatever you choose for meat. That's not going to contribute any fiber. But 1 carrot, 1 stick of celery, half a banana, lettuce and tomato. And dinner would include half a cup of broccoli, half a cup of quinoa, or a half cup of brown rice. Snack would include 2 cups of popcorn and a fresh orange. That gives us about 36 grams of fiber for the day. I think that's a pretty reasonable daily intake, and I look forward to feedback on that one. I know everyone eats differently, right? Everyone eats differently. But I just thought sometimes it's nice to see what, there's all these great recommendations. What does that look like in real life? So as we start to look at protein, think about, again, up with fish, right? Especially the fatty fish. Also, anytime you have poultry, be it turkey, be it chicken, take off the skin, take off those little clumps of fat, right? And then eat it. So make sure it's as low fat as possible. Beans and legumes, lean protein, great source of fiber, also provide some of those antioxidants. And eggs. Don't let eggs get a bad rap. They're a great source of protein and fat, and they have lots of vitamins and minerals. They have lutein, which is important for maintaining eye health. So talk about fish for a second. Fish, the cold water fatty fish. So salmon, halibut, herring, mackerel, sardines, trout, right? Trout from our streams right here in Colorado. The fat helps provide the omega-3 and omega-6 fatty acids. In general, the American diet tends to be a little bit high in omega-6s. You really need a balance of omega-3 and omega-6. Other sources of omega-3 fatty acids, just for your info, flaxseed and walnuts, good sources of omega-3s in addition to the cold water fishes. So again, beans, legumes, and beans and legumes, so black beans, pinto beans, lentils, navy beans, all of the beans. Phytoestrogens, tons of fiber. You can, and make it fun and exciting, right? Because people think, beans, not so excited, right? Hummus, very exciting. Great spread for your sandwich. Refried beans as part of your Mexican meal one night. Black bean soup, especially this time of year when it's cold, it's great to have bean soup. 3-bean chili with a little bit of ground elk or something in there. It's a great way to get beans into your diet because they are high in fiber and they are low in calorie and also inexpensive. So I kind of like all of those things. Limiting red meat to a couple times a week. Again, this comes from the American Heart Association. Trim the fat. You can trim the fat after you cook it. That's okay. Because, if you trim the fat first, it's going to curl. It's not going to be as flavorful. I get it. The fat adds flavor, but trim the fat before you eat it. Avoid the processed meat. So again, hot dogs, bologna, beef sticks, all of that processed stuff, mortadella, salami. It's high in fat, it's high in additives, it's high in preservatives, the things that aren't so good for our heart. So moving to fats, right? The healthful fats, the fats that are much better for us. Olive oil, nuts, nut butter, seeds, so pumpkin seed, sesame seed, things like that. Oil-based salad dressing. I didn't put it in here, but avocados, sort of I'm just going to say the elephant in the room, right? Everybody's like, oh, avocados, great. I eat lots of avocados. Avocados are full of fiber. They're full of vitamins and minerals. Avocados are full of fat, too. So moderation is the key to life, believe me, right? A quarter of an avocado is a reasonable portion. A whole avocado is unreasonable. too much fat. Same with nuts, right? I love nuts, but I say a handful, not a canful, right? Moderation. Because yes, they have healthy fats, they still have fats, right? The most dense energy source. So, talked about removing the skin and the fat from proteins, lower fat dairy products. So I listened to a presentation by a dietitian a couple years ago, and her comment was that we are dining on disease here in America, and her reference was to the cheese, the sour cream, the fatty things, the sauces, the gravies, right, that we put on all of our foods. And she was right. I mean, all of those things, they increase our risk of diabetes, heart disease, and stroke. So selecting lower fat dairy products, using smaller amounts, using things like Greek yogurt in place of sour cream really helps to, number one, increase protein intake, which is a bonus, and decreases the amount of fat. And sort of fat, dairy products and desserts, same sort of, moderation, key to life. Dessert should be a every now and again thing, not an everyday thing. Maybe share it, maybe eat half, put the rest in the freezer for another day, that kind of thing. So, back to real life. What does this look like? It's like, Sal, you're telling me all this stuff to eat. What should I put on my plate? Well, so both of these are examples of the My Plate, which is the USDA recommended sort of eating style. And it looks like you can see both of them. Half the plate, fruits and vegetables or vegetables. 1/4 of the plate is the starch or the whole grain. 1/4 of the plate is the lean or the healthy protein. Right? And just sort of keep that in mind instead of trying to figure out portion sizes, how many portions, how many cups did she say? I can't remember, right? But it's easy enough to take a look and say, oh, right, half my plate, fruits and vegetables, half my plate, the starch, the grain, and the protein. And I just brought 2 plates to sort of remind you about that portion control, right? This is the size you want, the 9-inch plate, not the huge dinner plate. Some people even take their large dinner plates and put them in the garage and never use them again. I would recommend that. Or you can put a plant on them. But get rid of the big plates and use the small plates, right? It's just automatic portion control. And this is the information, too, I said that I would get to. So how many calories do you need, right? The average male needs somewhere between 2,000 and 2,600 calories per day, depending on your activity level, right? Activity important. 8 to 10 cups of water per day, again, comes from fruits and vegetables, so that's always a good thing. And it comes from plain water and not even like the seltzers that, Dr. Weedle told us to avoid for, so they don't irritate our bladder. But watch out for the sugar-sweetened beverages. They are high in calories. Watch out for fruit juice. It's high in calories and it goes down so quickly. And I have to say, I don't recall seeing many people, except for little kids, drink the 4 ounces of juice that's a serving size, right? Nobody drinks only 4 ounces of juice. Your grandma did a long time ago. She had the little tiny juice glass, but nobody has those anymore. They drink 12 ounces at a time, and that's a lot of calories. So watch out for that. So as we age, we may need more of these things, but the caveat is always check with your doc, right? Before you add any supplements and things like that, check with your doc because you want to make sure that there will be no interactions with any of your medications. So as we age, we do need more calcium, more vitamin D. Of course, bone health is the first thing that we think about. Sometimes we associate osteoporosis with women only, and men can also get osteoporosis. So paying attention to bone health, calcium and vitamin D, the recommendations are here. And where do those things come from? Well, dairy products, right? The lower fat dairy products. Some from fish, some from dark leafy greens, some from beans, some from almonds, things like that. So again, eating a variety of foods helps ensure that you get the variety of vitamins and minerals that you need. Vitamin B12, that one is often recommended as we age. couple different things. We don't absorb it so well as we get older. Some medications interfere with the absorption. We need it for red blood cell development and to keep our DNA healthy. Some of the sources, you can see the proteins, right? Meat, poultry, seafood, dairy, eggs, and nutritional yeast. I don't know about you guys. Nutritional yeast is one of my favorite things I keep in the fridge. And it's, so it's a yellow powder-ish thing, and I use it on popcorn because it tastes a little like Parmesan cheese, but it's not salty. And it's a great way to sort of get it into food. You can sprinkle it on vegetables or rice or things like that. Vitamin K, so again, check with your MD about this, because if you're on warfarin, you want to make sure that you don't get too much. You can eat some of these things, but the key, moderation. So check with your doc. Vitamin K necessary for blood clotting and for bone health. Some of the well-known sources are the dark green leafy vegetables like spinach and kale and chard and things like that. Also available in bananas, oranges, and sweet potatoes. Magnesium, that seems to be one of the buzz nutrients these days. And because it's needed for many functions in the body, right? Muscle and nerve function, energy production, helps to regulate blood pressure, and found in lots of green, the leafy greens, legumes, nuts, seeds, and by golly, you can get it in a container and scoop it into your beverage and drink it too, right? So it's available all over the place. So multivitamins, I said I would get to these. And so first things, please know, I don't promote any brand or any source of them, because I see Amazon listed kind of a bunch on here. The idea is that they may be a good idea if you have a restricted diet or you don't have such a good intake, or maybe you have some absorption issues. So a multivitamin might not be a bad idea. This list I simply got from an article written by a dietitian. So all of these were reviewed by a panel of dietitians. They are reasonably adequate, so they might be a good option for you. Again, I'm not pushing any one or the other of those things. Let's see where we are next. Oh yeah. So some of these foods have been specifically linked to men's health or mentioned in conjunction with men's health. So some of the dark red foods, the tomatoes, the pomegranate juice, those are linked to lycopene. That's one of those phytoestrogens that I talked about earlier, phytonutrient. It has been, again, linked with men's health. It may help improve men's health. It may not. Some of the research is saying that it might help reduce the risk of prostate cancer, and it might protect cells from damage. Especially the red items, the red food items, they need to be cooked to be most available. So tomato paste, sun-dried tomatoes, tomato sauce, things like that. Pomegranate juice versus fresh pomegranate is the way the lycopene is going to be the most available. I talked about broccoli and the cruciferous vegetables earlier. They have antioxidants and anti-inflammatory characteristics. Green tea, great source of antioxidants. There are some schools of thought that say a cup of green tea a day is as good as an apple a day. Legumes and soybeans, great sources of phytonutrients. And going back to the fish, it's the fatty fish. It's the fish with the omega-3s that protect your heart that are the best ones. So, and this slide might look familiar. It's the slide from Dr. Lydia's presentation a couple of weeks ago. And again, just going back to some of the supplements and things that, again, saw palmetto inconclusive for health. Lycopene may be helpful, not sure, right? And research is always being conducted on foods, fruits, vegetables, everything, and cancer and other conditions to see where are the correlations and how can we eat to the best of our ability. I did want to take a second to talk about selenium. Selenium is a nutrient that's important for us. It's good for brain health. Some of the sources are there. One of the other sources is Brazil nuts, and that's some of the research has recently shown that Brazil nuts are great to help lower our LDLs, or the unhealthy fats in our blood. And the amount of Brazil nuts is 1 that can be helpful. That should be taken daily. Because selenium can also be toxic. So a handful is too many. Eat 1 Brazil nut, please, and thank you. And not more than that. And I say this because the more people I talk to are like, oh yeah, Brazil nuts, those are the new thing. Save my heart. It's like 1 is all you get. Okay? Yeah, I just want to be clear. All right, so here is the bottom line. Make sure you do your homework, get your facts. I love number 1. So this is from the USDA. Yeah, there are no magic foods. Just in case you're wondering, they're not. If it's there, you'll eat it. So make sure the things that are in your cabinets are carrots and celery and not cheeses and Cheetos, right? Make sure your whole grains are part of your daily intake. They make you feel full, they keep you regular, all those things, right? Build habits that don't add pounds. This one makes me think of popcorn instead of potato chips when I'm watching a movie, right? Because popcorn, remember that 2 cups of popcorn, there was 7 grams of fiber. That's a great source of fiber. Water is your friend, truly. 8 to 10 cups a day, please and thank you. The amount of calories per day for the average male, 2,000 to 2,600. Get beyond survival cooking. Yeah. Did I mention I was a chef? Can I just say, the Marie Callender's frozen meal is maybe a little tasty, highest in salt, highest in fat. Please don't eat the Marie Callender's frozen meal. And I know I'm using a brand name, oh my gosh. I'm just going to say, read the labels on all the, if you eat frozen meals, please read the labels. Please don't make them a habit, make them the, oh my gosh, emergency food. And even if you're not a cook, you can buy some things that are close to prepared in the grocery store and put them together. I'll say, one of my favorite things to recommend is the round platter of raw vegetables. It's like the party platter. But just bring it home and use it to eat or to cook with. It's like somebody cut up your broccoli and cauliflower and carrots for you already. That's perfect. Throw away the ranch dressing in the middle, right? And eat the vegetables because they're already cut up and ready to go. You can get chicken that's grilled and ready to go. You can get the roast chicken, right, at the Safeway and take home the roast chicken. That's fine. Try to keep it simple. Try to keep it clean. But please do a little bit of cooking or some clean, easy preparation if you're not a cook. And even things like people say, well, I only eat at McDonald's. And I say, great, they have salad at McDonald's, believe it or not. And they have grilled chicken and not the breaded chicken there as well. So, yeah, be a food snob. Nothing wrong with that. Pay attention to what's in your food, right? If the food has an ingredient label that has a fat or a sugar as one of the first few ingredients, it's probably a bad choice. Sweat is not bad. This is true. I don't know if anybody, I'm sure somebody talked about exercise during the course of this series, but 2.5 hours a week or that 150 minutes per week of exercise, 10,000 steps a day, do something, do anything, but be active, right? It's good for your whole person. And I skipped a little ahead. The last, number 10 on that facts was fill your plate like my plate. Again, half the plate, fruits and vegetables, quarter of the plate, starch or whole grains, and a quarter of the plate, lean proteins. So, give me your questions. And if I can answer them, I will. And if I cannot, I will find an answer and get it to Allison, who will share it back out to the group. So you're going to do your magic,
That
and
sounds
then we'll go from
perfect.
there.
Yeah.
Great, thanks.
I have a quick question, Sally.
Yeah.
before I have to go. A lot of my patients talk about, well, I can't eat fruit because that's sugary. And I wanted to hear your opinion, because in my mind I thought whole fruit is a different way of thinking. It's not the same as sugar.
That's a great question, Sarah. So yeah, fruit is a great source of many nutrients. It does